Over the last few weeks, we've been bringing you live interviews with local doctors to answer your questions about COVID-19 in Arkansas. If you have a question, you can send it to us on our tip line. You can text it to 479-785-5055. This afternoon, we are joined by Dr. Justin Voris. He is a family practice physician with Baptist Health in Fort Smith. Doctor, thanks for being with us.
Absolutely. Thanks for having me.
So the first question we have is talking about kind of the trend that we've seen with COVID-19. Do you feel like Arkansas is close to the peak of COVID-19 cases, or how long do you expect this to go on for?
You know, I don't think that we're just at the peak yet. We've seen some projections, and there's been a lot of numbers that have been thrown around. Obviously, a lot of people are going through some metrics and looking at the data that we do have. The University of Washington has actually done some really interesting data analysis, and that's a good resource if people want to look at that. And obviously, the Arkansas Department of Health has some projections that obviously offer some great guidance there, too. So as of right now, from the literature that I've reviewed, I think we're still 3 to 4 weeks away from a peak. And that really kind of depends on what kind of peak you're looking at. Is it a peak for active cases or peak for resources being utilized? And is that kind of a both question? That's a big question mark. But we're roughly looking to see about 3,500 cases by the end of April in the state of Arkansas, and probably hopeful to have less than 1,000 hospitalized, but yet to be determined.
Gotcha. All right. This is something that we've talked about before, but I think there's some confusion about it. How is this virus spread? And I know the question I've gotten from a lot of people is, how can someone who's not showing any symptoms spread this virus?
Yeah, that's a tough one. It feels like we're just kind of beating this around at this point, but it's aerosolized. It comes just kind of like most viruses do come in droplet particles, whether it comes from a sneeze or a cough. That absolutely can be transmitted in the air. It can be left on a handrail or a doorknob. A sneezed in hand. That's why we're talking about washing your hands and covering your mouth with your arm and not necessarily your hand. So spread just like we've been talking about for weeks.
Is there a difference in the type of or the size of the droplets that can come from a sneeze or a cough versus someone just breathing? And can someone who's sick and just be breathing spread that virus?
Yeah, you're getting kind of minute there. So, and that's okay. I don't think so. Obviously, the bigger particles come from sneezes and coughs versus somebody just breathing. I'm sure you've seen a YouTube video of a slow motion sneeze.
Yeah.
You haven't really seen a YouTube video of a slow motion breathe. So I think we'll be okay from people breathing as long as you keep that 6-foot distance.
Okay, and that's why that social distancing is so important.
Yeah, absolutely.
Correct?
Yeah, absolutely.
Okay. So I know we've talked about the main symptoms of COVID-19 at this point are fever, cough, and shortness of breath. That's been publicized. But are there other symptoms that people should be keeping an eye out for that could alert them that something is wrong and they could have this virus?
Really, fever, cough, shortness of breath, fatigue. That's kind of one that has been out there for a bit. If you kind of dig into some of the CDC details on some people who've experienced more than we have in our area, they're seeing some people that are having sore throat, some abdominal discomfort, some diarrhea even. So there are some other minimal symptoms, but for the mainstay, it's the fever and the cough and the shortness of breath.
And what is considered a fever in an adult?
Anything over 100.4 typically, but in this case, we're saying anything 100 and above. That's for right now.
And that should be sustained for a certain amount of time, or how often, if someone tests and they have a fever, how often should they check it before they're concerned that that is a sustained fever?
Yeah, that's a good question. Probably 24 hours at least.
Okay.
So, I mean, people have fevers for things other than COVID-19.
Sure. We got this question from Megan. She's asking, can you cough up mucus with COVID-19?
Oh, yeah. And so that's kind of one of those other little details that you'll find in the CDC data. Of the symptomatic patients that are out there, about a third of them will cough up some mucus. So it's not a very typical thing, but it does happen. And we know that 80% roughly of people that do get contacted with the SARS coronavirus, that they won't have any symptoms at all. So the ones that are symptomatic, about a third of those will have some kind of mucus production.
And I know it can be confusing, right? Because you were talking about there's other illnesses that are out there. It's still flu season. And so how do you determine if this symptom is COVID or something else, right?
Exactly. So that's where I think that the hotlines have come into play. UAMS, obviously Sebastian County and Baptist and Mercy have got a joint hotline that you can call, and they have really good screening questions. Obviously, we can't be 100%, but that's when you call your local health professional, your doctor, and you talk with them and say, hey, look, here's what's going on. I'm glad we have telemed now. We've been able to see a lot of patients through telemed and say, look, this exists. You've had an exposure or a potential exposure, and here's what you need to do next. And so I'm thankful that we have those options. But
that you've had contact with someone who's tested positive, or you had traveled to an area that has it. Now that we know that we have community spread here locally, how important are those questions anymore? Is that something that's still factored in?
Yeah, it is still relevant because people have still been on the selfish side, and they've still traveled, and they've gone to other places, and they've crossed state lines, and then they've been to big cities, and then they've come back, or they've talked to people and they've not maintained their 6-foot distance kind of aspect. And I still think it's a valid point. So yeah, we should still be mindful of that.
Gotcha. All right. Thank you so much for answering those questions. We'll have more for you coming up after the break. First, though, we will have your forecast. That's coming up next. Well, this afternoon, we're joined by Dr. Justin Voris, a family practice physician with Baptist Health in Fort Smith. He's taking your questions about COVID-19 this afternoon. We got this question from Maggie for you, Doctor. She's asking, how long does the COVID-19 illness last?
Really, that's kind of a variable. If you have no symptoms, you really don't have any outward signs of actually having the sickness, but technically you have it, right? We do know that 80% of those people that have the virus don't really have any symptoms. From there, it's kind of variable. Some people, it can be a week. If they're hospitalized, they might be into the 2-week mark and even beyond. I don't know of any cases beyond 2 weeks, but then again, we haven't seen too many cases around here.
Gotcha. Yeah, and we're still waiting, obviously, for that growth to happen, which I'm sure it will. I know we've gotten the question asking for people with compromised immune systems. What are ways they can prevent themselves from getting sick?
Unfortunately, and maybe fortunately, immunocompromised people already kind of have a pretty good handle on social distancing. They already have a weakened immune system, and they've really paid attention to that for a long period of time, at least since they've been diagnosed with their illness or chronic illness. And so they do a pretty good job of social distancing. Everything that we've talked about for weeks, washing your hand, covering your coughs, they've known about this long before COVID-19 existed. So they've got a pretty good handle on it.
May is asking this afternoon, she says, I am under self-isolation by doctor's orders, and 2 of my adult sons live with me. How much are they putting me at risk by going and hanging out with their friends, and how do I explain to them the potential dangers of their behavior?
Yeah, so that's a tough one because essentially it's like her going to hang out with the kids' friends as well, right, without her even leaving. So it's the same risk as her being out there. So education is really primary, talking to them, and who knows if she has any chronic health conditions. Is she over 65? Does she have those telltale things that were talked about that put her at a higher risk? And so that elevates her risk in certain situations. And that's really the biggest thing that she needs to educate her sons about. And so getting that distance, like we've talked about.
Sure, but if they're leaving and exposing themselves to other people, then whatever they bring into that house can be exposing her as well. And that's the case with any family, right?
Yeah, exactly. Unless she's isolating herself in a room that has a bathroom and a kitchen, right? Or somebody's giving her food. So, yeah, absolutely.
Okay. We got this question from Sandy. Obviously, we know restaurants are closed right now except for delivery and carry out and such. Is it really safe to eat takeout food?
Absolutely, it's safe to eat takeout food. I think that restaurants are going to extreme measures. They were already under high scrutiny anyway, and now that this has kind of trumped it, they're really not wanting to lose their business. This is people's livelihoods, and you have people that are not chain restaurants. You have, mom and pop diners. You've got other restaurants that struggle on the daily basis, and now you put them in a economic issue here, along with healthcare. They're going to do everything they can not to jeopardize losing their business. So I think that it's absolutely safe because they're not going to have somebody come in that's sick, they're going to test those people. At least they should be anyway. So you have to put faith in humanity at some point, which can be a tough thing to do sometimes.
Sure.
But yeah, we have to take it that these people are working hard and probably harder than ever just to maintain being able to feed their family and their employees' family.
Right. We got this question from Tommy asking, is there a risk of COVID-19 transmission from mail or from packages received in the mail from other states or maybe even out of the country?
I looked this up the other day because somebody had asked me the similar question, and there's a theoretical risk for everything. Yeah, it's possible, but since this is an RNA virus, we really don't think that it lasts too long on packages and things that are exposed, even things that are from room temperature to frozen temperatures. If you kind of dive into some of the CDC data, it even says that, hey, we don't think that this lasts very long at all. So is it possible? Yeah, but somebody would have had to sneeze right on it and handed it to you, and then you would have had to touch your face or something like that.
All right, definitely good to know. Thank you for answering those questions for us. We'll have a few more for you after this break. Don't go anywhere. We are back this afternoon with Dr. Justin Voris, a family practice physician with Baptist Health in Fort Smith, talking about the coronavirus. We've gotten this question from a number of people asking, would the pneumonia shot help prevent patients from getting so sick? What can you say about that?
Not related to the COVID virus, because you're inherently talking about two different things. So I'd say absolutely not. Can it help prevent the most common cause of pneumonia? Sure, because that's a bacterial type of pneumonia. And so that's where the pneumococcal vaccine comes into play, but not as it's related to a virus.
Gotcha. I know this has been something I've seen kind of talked about on social media, saying, should I worry that my shoes could be bringing COVID-19 into my home?
Social media strikes again. So, yeah, no. If you're worried about it, leave your shoes in the garage. Unless you have a high rate of exposure, if you're working in a hospital or you're around potential COVID patients all the time, then yeah, you might have something to worry about. But if you went out on a hike in the beautiful state of Arkansas, there's not a very high likelihood that you're going to have COVID hanging out on your shoes as you traipse home. So, but if you are worried about it, leave them in the garage, put them somewhere where you're not worried about it.
Sure, that's good advice. Mary's asking, is the COVID-19 virus evolving? What do we know about that?
It's not really something I could probably answer because I don't know. And I think that's the hard part about a lot of this is that we don't know a lot about it. Could it be evolving? Maybe, but probably not. It already did something once to get to where it is now. It's probably in the state that it's going to stay. And that's why you're looking ahead towards vaccines and things like that that are going to be eerily remnant to what it is right now. So unless the CDC is doing some research, which they probably are, I don't know how to answer that question 100% accurately.
Sure. I know this is a tough time for everyone, especially for healthcare workers on the front lines. I did get this question texted to us this afternoon, just asking personally, how is this pandemic impacting you, and how are you coping with all the stress that comes from this?
Yeah, I know. I'm a pretty laid-back guy, so I don't really let a whole lot of things get to me. I think that we're all taking it in stride as healthcare professionals, and this is something that we think about and we see every day. Maybe not necessarily coronavirus, but we have to make hard healthcare decisions every single day. So this is just another one of those stressors. Yes, it impacts everybody financially and things like that, but as regard to the economy. But as far as a physician, it hasn't impacted too much because I'm still seeing healthy people. I'm still seeing sick people. That doesn't really change. And do I worry about taking something home to my family or friends and things like that? Absolutely. But we're doing all the necessary precautions that we can at any point that we can, really.
Good to hear. We appreciate that. We'll have your final word after the break. Don't go anywhere.
Okay.
Through this whole COVID-19 pandemic, we have been welcoming medical professionals to answer your questions about the coronavirus. All you have to do to ask a question is text the number on your screen there, 479-785-5055. Don't call it. Text that number, or text to that number, 479-785-5055. This afternoon, we're joined by Dr. Paul Bean with Mercy Healthcare in Fort Smith. Dr. Bean, thank you so much for joining us this afternoon. One question we've gotten a million times, and we are grateful for hospital staff in this pandemic. What struggles are nurses and doctors and other medical professionals facing right now?
Well, the greatest things that we're dealing with right now, of course, continue to be personal protective equipment, and then the lack of testing. We're obviously, this is something that's on everyone's mind, and it's and the coworkers are afraid and concerned just because they're worried we're not going to have the supplies we need at the time that we need it.
Yeah, and the next question kind of goes into that, the PPEs. This question is, I'm a nurse in the River Valley. I'm only given one mask to use for the entire day. This is going on at clinics and emergency rooms all over, this person says. Is there enough equipment to use now or on the way, or is this going to be the new norm?
Well, steps like this are being taken by all healthcare facilities in order to try to conserve masks. Currently we have ample supplies, but of course we don't know exactly how big our surge is going to be. So I think everyone is a little bit uneasy because we're unsure how many masks and gowns and gloves and shields are we going to need when the surge actually happens.
Yeah, and I think that's a concern I think a lot of hospitals are feeling now. In fact, the next question actually from a viewer says the governor's personal protective gear is ordered. It's on the way. Where do our hospitals stand compared to in central Arkansas? We know that's where the epicenter of Arkansas, if you will, is right now in central Arkansas. Will most of this equipment go there, or will we get ours in northwest Arkansas and the River Valley?
So the equipment that the governor is purchasing, it's my understanding that that'll be distributed throughout the state based on population.
Right.
It'll be handled through the Emergency Preparedness Network. They're keeping those in reserve for the time being. And of course, those hot spots that are going to pop up, like for instance, Central Arkansas is more active right now than we are in the River Valley. They're going to get equipment first because their burn rate is going to be significantly higher right now.
And that's where the focus should be, where those hot spots are.
That's correct, because those are the people that need it the most right now.
Okay. Dr. Paul Bean joining us with Mercy Healthcare. We'll answer more of your questions coming up right after this break. All right, again, we are joined by Dr. Paul Bean of Mercy Healthcare in Fort Smith, taking your questions. Dr. Bean, again, thank you for joining us. Another question we have, are there, and this is confusing, I know I get confused because we talk about coronavirus, we talk about COVID-19. Are there different strains of COVID-19? Any particular strain worse than the others?
Well, coronavirus, of course, is actually a virus that we have endemic in our community. It is what makes COVID-19 different is it's a new strain of this particular type of virus that we don't have resistance to. So when you talk about COVID-19, there are multiple strains for COVID-19, but the differences between the strains are very minor. So they all behave clinically very, very similarly.
And that uncertainty is what's causing a lot of this anxiety, is it not?
Oh, it certainly is. I mean, people are it's an evolving process.
Sure.
When we started this, walking through this, that, initially it was COVID-19, then we thought there were 2 strains. I've heard the most recent literature I've seen is that there may be up to 8 different strains.
All right, so the next question we have, and what are the treatment options for COVID-19 patients?
Well, I think it's important to know, Darren, that the vast majority of people do just fine with this. Over 80% of patients will have a minor illness and will not require any additional care, okay? Of those patients who get sick, about 15%, or of that 20% that will require attention, 15% could be hospitalized.
Right.
And they'll need supportive care in the way of oxygen and treatment in the healthcare facilities. And really, there's only about 5% of people that get quite a bit sicker, and those are the patients that require the most help.
All right. What about? I'm sorry. Go ahead. Yeah,
I was just going to say there are treatments available, but they're all experimental. This is such a brand new process. There are a lot of experimental treatments available, but there's not very much science behind them at this point.
And
They're very small trials.
Yeah, that kind of goes with the next. That kind of goes with the next questions. Are there any drugs that are working right now?
Well, I mean, there's a small trial that showed that chloroquine or hydroxychloroquine, which is a medication we use for malaria, has some antiviral properties, and in some places they're combining that with azithromycin, and that's been shown to have some benefit. There are some experimental models where they're using some other antiviral medications that work against an RNA virus, such as COVID-19, but it's all trial basis at this point. And so because there's just not enough data to tell us for sure if this is going to be effective. They're being used in what we call compassionate usage. We're using them on patients that are critically ill.
Right.
And as kind of a last-ditch effort.
Okay. All right, we'll take one more break, come back with a final thought from Dr. Bean right after this.